Welcome to episode 20 with my dear friend, Dr. Deme Mydlo. She is a former PE and health teacher turned chiropractor. She grew up playing and competing in just about every sport, but finally found chiropractic care as a triathlete in her mid 20s. After seeing the improvement in her performance and always having a passion for health, she went back to school to be a chiropractor. Dr. Deme is passionate about preventative health and the role chiropractic can play in our bodies, especially to thrive and function at its best. Welcome, my friend. How are you?
I'm wonderful. Thanks for having me, guys.
Yeah, absolutely. Thanks for being on the show. Okay, so the first thing that we like to ask our guests is, what are you loving right now?
Okay. So I have one right here. I've never been a big sparkling water person. And I think I always like politely try them when I'm at other people's houses. So I tried Waterloo. I think it's a company out of Austin. And I think they are just like the king and queens of sparkling water. So all the flavors are awesome. And then the Human Longevity Project. It was a docu-series basically talking about the blue zones. And basically they're areas in the world that people are living to be over 100 years old, and it investigated like what are they doing that we aren't, and basically all the lifestyle factors. I don't know if you guys saw it, but I absolutely loved it. And they brought in a lot of the top researchers and functional doctors, and basically all the new science on microbiome and our mitochondria and how to optimize our health and all that good stuff that we geek out about.
Nice. I have not seen it. Have you, Megan?
I actually did watch some of it. So my Evan Brand, who is a functional medicine practitioner that I work for, he was on that documentary series. So I watched it just to see his tidbit. But yeah, it was super cool. I enjoyed the information that was in there. And it was just so neat to see like how these people that are living to be 100, 105 are and just radiant health, right? Like just stellar beings. And they're living in like little huts in the middle of nowhere where they have to like walk to go get their water or like to go do their laundry. I mean, it was really cool stuff. So that was a great documentary series. So if you guys can look that up and check it out, the Human Longevity Product by Jason Prowl, I believe. So it was super cool. I enjoyed it.
Okay, and then what is so fabulous about Waterloo? I think I've seen it at Whole Foods. Is it a pretty box?
It is a pretty box. It's pretty, but I think the biggest thing is I feel like after like one sip, like it just tastes like plain sparkling water, and like the flavors actually like last in these. And I've tried all of them. Like watermelon's my favorite. I've got a coconut right now, and yeah, like I've never been a big fan in any of them until these, and yeah, totally recommend them.
Wait, so where do you find them? Where do you find them at?
Like Whole Foods, Central Market here in Texas. So usually you're like farmers market type stores.
Okay, cool. Yeah, I've never heard of that company, so I'm gonna look into it.
Yeah. Then we can be sparkling water snobs.
Guys,
I know.
The cans are BPA free.
Nice.
Awesome.
And I was just about to make a comment that involves alcohol mixing with that.
I was thinking that too.
That would work.
Because I totally am a Topo Chico Tito's girl with like lime. So you're just
this would be your jam. Their lime one is really good.
Yeah, but you said watermelon. That really got my attention right now, especially because here in Houston it is like hot. Yeah. So I think I'm gonna have to look into this. This might be my Friday adventure.
You lead such an exciting life.
I know. Let me tell you about it. Super cool.
All right. So, Deme, we really wanted to talk to you today about chiropractic care and the nervous system and how it relates with stress, especially as well as like prenatal and pediatric care, because I know that I see all of your pictures of you working on little babies and you always just look like so happy and everything. So tell us just a little bit more about that in terms of maybe why a pregnant woman or a baby would come to see a chiropractor.
Definitely. So basically, most people, we get the concept of like, okay, if our joints are stuck or they're misaligned, they're not moving properly, and we restore the proper motion to the joint, that could feel better. And that's why most people come to chiropractic. Something hurts, right? Generally neck or back. And then what they find is, under consistent care for a while, that their overall health, their function starts to improve. Like, for example, I haven't had a gentleman come in with really bad low back pain, could barely walk in, and a couple of weeks later, he's feeling great. And he's like, Doc, I didn't tell you this, but I tend to be, kind of constipated most of the time, and I've been going, every day. Is that normal? And it's absolutely normal. We're restoring normal function. Chiropractic, we believe that our bodies have an innate ability to heal themselves, and that healing and function happens through our nervous system. What the heck does that have to do with chiropractic? Well, if you stop and take a look at a spine, which most of us don't really have any reason to do so, you'll see that all of our nerves exit through the vertebra of our spine. So if you have, structural problems, misalignment in that spine, inflammation around the spine, that can be affecting those nerves. So information that's coming in from our environment to our brain, if that's being kind of messed with, then the brain isn't going to give the right information back out to the different cells and organs in our body. So not only just physical, like I'm moving my body, those nerves, but nerves that go to our organs and glands. So what's really neat is, in respect to prenatal care and women who, sometimes they get pregnant under care even when they don't want to, because a lot of times what happens is you restore that, that proper nerve function to the reproductive organs. And so you get, regular menstrual cycles, the body's balance for proper implantation. So ideally, when people want to get pregnant, we'd like to see them under regular care. And then during pregnancy is just, it's like a marathon life event. It's like a whole thing to train for. Your body just completely transforms. So from a aspect of, a lot of women do feel pain during pregnancy because they're growing this, large being. Your body changes. I mean, your breasts grow bigger. It puts more stress on your thoracic spine. Your center of gravity changes. Hormones change, which make the joints loosen. So there's all kinds of things going on with the structure during pregnancy that, from a comfort standpoint, chiropractic helps immensely. But also, what's most important to me as a chiropractor is that I'm keeping the pelvis balanced in the proper position because the uterus is in there. So ideally, the pelvis is balanced, the uterus will be balanced, so baby can get in the optimal position, so we can have a healthy labor, so we can have a healthy baby. Does that make sense?
Yeah, that totally makes sense. Now, explain to us a little bit more about how or why a baby would see a chiropractor.
Okay, so anyone who's listening who has been through labor and had a birth can tell you that the process is traumatic, and we don't often talk enough about it, but it is a large baby coming out of a small exit. So even just naturally, the most perfect labor, it takes time for baby to come out, and a lot of times they're kind of wedged in there, and basically it puts stress on the cervical spine coming out, out of the pelvic outlet. So a lot of times we can see misalignment, just, most common, not always, but the very top bone of the spine, C1, the atlas, it holds up the head. So a lot of times we can see that is out of position, and the thing is most people don't, see anything wrong. And what happens is we have parents bringing in babies when, maybe we're having a hard time latching for nursing. A really common thing is, baby likes to latch on one side and not the other because they can't turn their head properly. or we see torticollis, which is, basically you'll see a lateral tilt to the head. The little neck muscle, the sternocleidomastoid, and the little baby is, really tight, and it's due to misalignment. The muscle is reacting to the alignment of the bone. So a lot of times we need to take care of both. And, just like how adults, generally we come in with something hurts, even the little ones generally really come in with something's off. So like colic, ear infections, those things. But sometimes in a perfect world, we get to check the babies within the first week or two. And when we make sure that everything is balanced, a lot of times we never see any of those issues. So that's why, we're big on education and then prevention, because a lot of people just have no idea that this can be helpful. And what we often hear is like way down the road, or people who are coming in with their second pregnancies, and it's like, man, I wish I knew that with my first, and then their story comes out, and it's so common.
Mm-hmm. I had no idea that you would see a chiropractor for ear infections and colic. That is fascinating.
Mm-hmm.
So we're not like directly treating those things. We're just like, I check the spine of a baby or toddler or teenager or an adult. I'm feeling for the same things. Now the adjustment is very different for every single one of those people. It's actually very, very gentle for a baby. But what happens is a lot of times when the alignment is restored and, the nervous system can work properly, those things kind of go away. So a lot of times if it's nerve supply with what's going on with digestion and things like that, we see the colic kind of go away. There is no, exact mechanism of there's an ear infection, adjust this. And, so it doesn't, perfectly work out, but I can say, what's neat for, I have a 17-month-old, and he's been checked weekly and adjusted since birth, and we've never had an ear infection or anything like that, and so I can't say, oh, it's absolutely because of this. But what I tell people, is I believe chiropractic is a big piece of the puzzle. When you look at the anatomy, of the baby's ear with the direction of the eustachian tube, when we get into the specifics, it makes a lot of sense.
Yeah, I mean, the structural component of the puzzle, like what you mentioned, is a huge, piece of it. So especially as NTPs and functional medicine practitioner, I mean, we learn that you've got like nutrition, you've got lifestyle, you've got movement, but like your structure definitely plays a role on how your body functions. So you've got to have that in line.
Absolutely. And in the same regard, I tell patients, like, you can't come to me and I can, line you up, but I can't adjust a bad diet. I can't adjust the fact that you don't sleep, or, so we address all of those issues too, and, and refer out when necessary as well. And that's why I say chiropractic is a tool in the toolbox. It's a piece of the, nothing is everything.
Exactly.
That's such a good analogy. I can't adjust a bad diet or that kind of thing. Demetra, last time I was in Dallas and we got to hang out, you mentioned, I believe it was 3 T's.
Yes.
Would you go into that a little bit more? Because I found that fascinating. And Megan, I actually voxed you about it because I was so excited about it.
Sure. Okay. So the premise in chiropractic is basically your body's resiliency, your body's ability to adapt to your environment, your surroundings. We know environment and epigenetics and all those things you've talked about in your other, podcasts and stuff is everything. So, what will allow my body, to adapt is different from yours. And it comes down to the stresses in our environment. And so just, a cute way to think about it is we always call them the 3 T's. So it's trauma, toxins, and geez, I'm totally blanking. It's trauma, toxins, and this is like the foundation, and I'm having a brain fart. But trauma,
it'll come to you.
Trauma people totally get, because I know why I totally blocked it out, because it's my least favorite. It's thoughts. We'll get to that. So trauma people get, right? They're like, I was in a car accident. I totally get that did damage to my body and I need to do something about it. and even like, or I, you know, ran a 10K and I never run, like people get that that's physical trauma, and, you know, there's a breaking point for the body. You know, toxins, I think is easier to understand too. Obviously you guys go well in depth in the podcast with this, just whether it's nutritional or what we put on our skin, you know, we are bombarded with toxins. So lifestyle factors to reduce those will help. You know, there's always a point to, you know, where our body cannot adapt. And then that last one is thoughts. And this is the hardest one for me, right? Like our mindset, you know, if you really think, you know, that you are going to do something, you really truly believe it, you will do it, and vice versa if you don't, you know. So this is why, you know, people talk about, you know, being positive versus negative. It really truly does matter. And you know, we know there's so many studies that, you know, show that your cells on every level respond to your thought process. So you know, sometimes we say in chiropractic, when we are, you know, not getting any further, we start to look at those things and we're like, you know, what is your toxic overload? What is, we always say, I mentioned the Atlas C1 is the first vertebra. And so sometimes we say, what's going on above the Atlas, right? So in the brain, you know, and sometimes, you know, sometimes we need to go to a counselor and there's things that we need to work through. But again, there is a structural component to all those things as well. So when we have that spine completely lined up and all of the nerves, you know, going to and from our brain are working at their best, our body can adapt to those 3 T's, you know, for the most part. Like I said, there's, you know, there's a breaking point with all matter.
Mm-hmm. Yeah. So
yeah, so good.
Yeah,
and it's just such a great way. Sorry, go ahead, Megan.
No, that's super cool. So I guess my like question on that note was, how do you know when your nerves, like, how do you know when that highway is functioning the way that it should?
I think, you know, what I try to, you know, tell patients is, as soon as you walk out of the office, you're bombarded with those stresses, right? You know, do you have a long commute? Are you stuck in the car? What do you do at work? Do you sit too much? Do you stand all the time? Do you lift? And, you know, all those things. So I think to some degree, we're always going to be a little bit off, but you raise that resiliency. And that's with any, you know, treatment that you're doing, whether you're supplementing the body with, you know, vital nutrients that you need, whether you're regularly getting adjusted, your body will hold on to that, you know, your body will hold on to that alignment longer, and your nervous system will function better the longer that your body can withstand those elements. And what we see, basically, we just see the outcomes through the process of a treatment plan, you know. And when we see that people are having those positive outcomes, that's when we say, hey, this is really exciting. Your body is working better. So, you know, we are graduating you. You're going to see less of me, you know? And so that's a good thing, right? Because, you know, we want to be able to take care of our bodies on our own. That's the goal for everyone. So yeah, I guess there is no, you know, exact way to know, you know, today, you know, by the time we feel things are out, they kind of already were. Like the dysfunction happens before symptoms, you know. You see that in so many different professions.
It's like the old man that started having regular bowel movements. It's like, all right, I guess the highway's working again.
Exactly. You know, and like that's a huge victory for him. Like the stories are just incredible. And I think in all health fields, you get to hear that. Like I came from sports. I never thought I would be specializing in like pediatrics and prenatal, but you know, just my philosophy, like it just was like a light bulb that went off for me. Like if we can, you know, start making sure that everything is working properly from, you know, from conception, you know, that's true prevention. And then, you know, and then you give them the education of all those other lifestyle factors that help as well. And so I was like, I want to be on the forefront there for sure.
I love that.
So something that was super cool when I was seeing you consistently, Demetra, before oh, when was it? It was actually before our midterm exam, Megan. So this was like right before we moved to Colorado. And I noticed that my concentration was so much better when it came time to study. And it was way easier for me to study for the midterm in our nutritional therapy program rather than the final exam because I wasn't seeing you consistently because, well, we both left Texas, but yeah, so it was super interesting and just, one of those highways that you didn't know was broken or under construction until it was working. And then I was like, oh my gosh, there's not so many squirrels. And it was way easier.
Well, I didn't know that, so thanks for sharing. But that's also a huge thing that we see with kids, and it's such a relief for parents sometimes too, because, like as you know, like ADHD is, that diagnosis is thrown out all the time, and it can be very frustrating for parents, and that's a perfect example of like it's just another tool in the toolbox because we can look at diet, sleep, behavior, and all those factors, but a lot of times the adjustment when the brain and the hemispheres are balanced and working properly, we do have a lot of kids report that they are better focused, and so things change at school, behaviors change. So we work with a lot of those kiddos too, and that's awesome.
Mm-hmm.
Yeah.
If you can save like an intervention, like the last thing I'll just speak for myself on this. The last thing I want to see, the numbers are starting to rise in our children being medicated. So that's the last thing I want to see. So I just feel like, we got a long life ahead of us, and if we can try an intervention before we resort to those things, that's the way to go.
Mm-hmm.
Mm-hmm.
Yeah. When I see kids for like nutrition consultations and they're young and they're either on like ADD or ADHD meds or just anything, I'm like, man, I wish that I could have got to you sooner. But also even like the importance of really seeing kids, like when you're seeing their parents and like, oh, will you see my kid? I'm like, heck yeah, I'll see your kid for sure. I'll teach that little one something about food.
Exactly. And that's what's really cool about something like this, because excuse me, you're providing information that people didn't know about, and it's not too late, right, to try another avenue. But yeah, definitely, and again, that's one of those things where hopefully like you'll think like when you're not getting those results, like, okay, what is it, and that's what we do with chiropractic. We start there, that's what we know, and then sometimes we have to, like, maybe it is the diet.
Mm-hmm. Yeah, that would be a good addition to your toolbox, is doing that functional medicine piece.
Definitely. Yeah, it's something that I've definitely thought about. One thing that I'm seeing a lot, it's just women our age. We are young and healthy, and we're having careers. And Casey and I were talking about this. We're having careers first, and we're delaying marriage and kids, and that's awesome. And but what we're finding is I'm seeing what looks like a perfectly healthy person. A lot of women are struggling, with fertility and things like that. And I had a patient who they're changed diet, changed a lot of things that they use in their house, products, overhaul, stress reduction, everything. And after a few adjustments, she got pregnant. So I feel like chiropractic was a big piece of that puzzle. But more often than not, we're doing all those things. We're adjusting regularly, and there's still a disconnect, right, in the body. And so that's what's really cool about functional medicine. And yeah, definitely, down the road, it would be something cool to add in, because you want to help every patient, get there with their goals and everything. And that's just it. The premise of chiropractic is just allowing that innate intelligence of the body to flourish. So what's in the way? Because our bodies can heal themselves. It's just finding that disconnect. And I think that Human Longevity Project that just kind of touched on it. There's so many things there, and that's what's really cool, that functional medicine is investigating, where is the disconnect? And what's cool too is, totally rambling, but there were a lot of chiropractors in there, and functional doctors and scientists, and just everyone on the forefront working together. And so I really think that all of these professions together, it's the future of our healthcare. Like, if I think Chris Kresser said it in the video, it has to change, and it's just whether we're going to openly change, or we're going to be forced into it, and that's a scary thought, the opioid crisis and everything that's going on. And but I think there's a large population out there just craving this information, looking for answers.
Yeah, I think you're absolutely right that there is such a large population just craving the information. Because, I mean, look at how many people we talk to who are just blown away at something so simple that they can eat butter and bacon.
Yes.
And they're like, what? Like, mind is blown that they don't have to eat margarine anymore, or I can't believe it's not butter. And it's just something so simple like that. And I mean, there's so far to go and so many opportunities for us as practitioners to help spread this knowledge.
Absolutely. And butter is like, just when you tell a patient you have to change their diet and their shoulders slump, like, and they're just like, oh, here we go, take away everything that tastes good, you can tell them that they can have butter. I mean, that's a pretty amazing thing.
And it makes everything taste good.
Exactly.
All right, yeah. Dr. Deme, I know we could talk to you for so much longer. We're going to have you back on, but I know you have a patient coming in. So tell our listeners where they can find you.
So I'm located in Dallas. I am near Royal and 75, and you can find me on Facebook or wholeheartedchiro.com or on Instagram. And I would love for you to come in and get your spine checked.
Excellent. Yeah, and we will link all that up in our show notes and everything. And this episode will be coming out, when will it be? Next week. I don't know the date, but yes.
Well, thank you guys for having me.
Yes, thank you so much for hopping on. It was so great to see your pretty little face.
Thanks,
ladies. Thanks for all your knowledge.